If getting out of bed feels harder than it used to, if your legs feel slow in the morning, if your balance feels a little less certain, I want you to know something right away. That change did not come from nowhere, and it does not always mean you are simply falling apart. Very often, the body after 60 is not asking for harsh workouts or painful routines. It is asking for better support. It is asking for small, gentle habits done at the right time and in the right way. And here is the hopeful part. Small habits can change how you walk, how you stand, how steady you feel, and how much confidence you carry through the day. Stay with me, because one of the most helpful habits is also one of the most overlooked, and many people do the exact opposite without even realizing it. I have seen this again and again. A person says, "My knees are stiff, my hips are tight, and I just don't move like I used to." But when we look closer, the problem is not only age. It is the morning rush. It is long hours sitting. It is standing up too fast. It is weak leg muscles that have not been challenged in a gentle way. It is poor sleep. It is shoes that do not support the feet. It is sometimes even medicine side effects, dehydration, or fear after one bad dizzy spell. And once that fear shows up, many people start moving less. That feels safer at first. But then the body gets stiffer, weaker, and less steady. So today, I want to help you break that cycle with 5 gentle habits that may help you move better after 60, protect your independence, and help you feel more like yourself again. Before we get into the first habit, I want to say this with care. If you have chest pain, sudden shortness of breath, fainting, new confusion, new one-sided weakness, face drooping, trouble speaking, or a sudden severe change in walking, do not wait for a video to fix it. Get medical help right away. But if your problem is the slow, frustrating change so many older adults notice over time, these gentle habits may be a very good place to start. And if you're watching because you want to stay steady, walk with more ease, or help a parent or partner move better after 60, tell me in the comments how old you are, or tell me which part feels hardest right now. Getting out of bed, standing from a chair, climbing stairs, walking outside, or keeping your balance. I read those comments, and they help me know what videos to make next. If this kind of calm, simple guidance helps you, subscribe and stay with me, because my goal is to make health feel clear, safe, and useful. The first habit is to stop starting your day so suddenly. This is one of the biggest mistakes I see. Many people wake up, throw off the covers, swing their legs over the bed, and stand up right away. Then they wonder why the room feels off, why the knees feel stiff, or why the first steps feel weak and awkward. But think about it. Your body has been still for hours. Your joints are cool. Your muscles are quiet. Your blood pressure may shift when you stand. Your balance system is not fully awake yet. So instead of asking your body to perform on command, wake it up with kindness. Before you stand, stay seated or lying down for just 1 minute. Point and flex your feet. Roll your ankles. Bend and straighten your knees a few times. Gently tighten and relax your thigh muscles. Open and close your hands. Roll your shoulders. Take 2 slow breaths. Then sit on the edge of the bed for a few seconds before standing. If you tend to feel dizzy, keep one hand on something stable. That 1 small minute may sound almost too simple, but it can make those first few steps safer and smoother. And those first few steps matter, because they shape how confident you feel for the rest of the day. Let me make this real. Imagine 2 mornings. In the first one, you jump up too fast, your back feels tight, your foot lands awkwardly, and right away your brain says, "Be careful. Something is wrong." In the second morning, you give your body a slow start, your ankles loosen, your hips wake up, and your balance settles before you even begin walking. Same body. Different start. That is why gentle routines matter. They do not fight the body. They work with it. The second habit is to move often, but in small pieces. Many people think better movement after 60 means doing one long exercise session. And if that works for you, wonderful. But for a lot of people, especially if they have stiffness, joint pain, or low energy, the better answer is something much simpler. Move more often during the day. A short walk after breakfast. A few minutes of standing and stretching after lunch. A slow lap through the hallway in the evening. These tiny movement breaks can help joints warm up, improve circulation, and keep the walking pattern from getting smaller and weaker. Here is the trap many people fall into. They feel stiff, so they rest more. Then the body gets even stiffer, so they rest even more. Soon, standing up feels harder, balance feels less steady, and walking feels like work. Sitting itself is not the enemy. We all need rest. But too much sitting, without gentle movement in between, can quietly steal strength and confidence. So I want you to think smaller, not bigger. Do not ask, "Can I do a big workout?" Ask, "Can I move for 5 minutes, 3 times today?" That question is kinder. And it is often the one that actually gets done. If going outside feels easy, a short walk on level ground is wonderful. If outside feels unsafe or the weather is bad, walk inside. Walk through the living room. Walk while the kettle is heating. Walk at the grocery store holding the cart. March lightly in place during a commercial break. These little choices count. They are not silly. They are training. They tell the body, we still do this. We still stand. We still walk. We still trust these legs. Now here is the part many people miss. The goal is not only to move more. It is to move before stiffness gets too loud. If you wait until you feel locked up, you are already behind. Gentle movement works best as prevention, not punishment. Even 2 or 3 minutes can help interrupt the stiffness cycle before it takes over your whole afternoon. The third habit is to build strength and balance in plain, everyday ways. This is where a lot of older adults get discouraged. They hear strength training and picture heavy weights, loud gyms, or hard floor exercises that do not fit their body or their life. But gentle strength and balance work can be simple, safe, and deeply practical. In fact, one of the best exercises for moving better after 60 is something you already do every day. Sitting down and standing up from a sturdy chair. This move matters because it trains the exact muscles you need for real life. Your thighs. Your hips. Your core. The muscles that help you get off the toilet, get out of a car, stand up from the couch, and recover if you trip. If standing from a chair is hard, that is not a reason for shame. It is useful information. Start where you are. Use the armrests if you need them. Move slowly. Sit down with control. Stand up with control. Maybe you do 3 today. Maybe next week you do 5. That is how progress often looks after 60. Not dramatic. Just steady. Another simple option is holding the kitchen counter and gently rising onto your toes, then lowering back down. This helps wake up the calves and ankles, which play a big role in balance. You can also hold the counter and shift your weight gently from one foot to the other. Or stand tall and lift one knee a little, then the other, as if marching slowly. These may not look impressive, but they train the body to react, support, and stabilize. And that is exactly what helps prevent falls. Please remember, gentle does not mean careless. If you have had a recent fall, recent surgery, severe arthritis pain, chest discomfort, or a major heart or lung problem, talk with your doctor or physical therapist before starting a new routine. Stop right away if you feel sharp pain, feel faint, or become very short of breath. There is no prize for pushing through warning signs. The goal is safer movement, not tougher suffering. The fourth habit may surprise you, because it does not look like exercise at all. Protect your hydration and slow down when you change positions. This matters more than many people realize. A lot of older adults tell me they feel fine sitting down, but a little lightheaded when they stand. Some feel unsteady walking to the bathroom at night. Some feel weak in the shower or after getting out of a chair. Sometimes the reason is more serious and needs medical attention. But sometimes it is related to standing too fast, not drinking enough fluids, poor sleep, low blood pressure, or side effects from medicine. As we age, the sense of thirst may change. Some people simply do not notice they are getting dry. Others drink less because they do not want to use the bathroom often. I understand that. But even mild dehydration can leave you feeling tired, weak, foggy, or dizzy. And dizziness can take away movement confidence very quickly. So if your doctor has not told you to limit fluids, try sipping water through the day instead of waiting until you are very thirsty. Keep water where you can see it. Drink a little with meals and between meals. If plain water is hard to remember, try a routine. A glass after waking. A glass with lunch. A glass in the afternoon. Something easy to repeat. And just as important, slow down the transitions. Before you stand, pause. Put both feet under you. Stand near a counter or chair if you tend to wobble. After standing, wait a moment before walking. Let your body catch up. That pause is not weakness. It is wisdom. It can be the difference between feeling steady and feeling startled. Now, if you often feel dizzy, if you faint, if your heart races, if you have new swelling, black stools, confusion, or chest pain, please get checked. Do not guess. Also, never stop blood pressure medicine, sleep medicine, pain medicine, or any prescription on your own because of a video. But do bring these symptoms up with your doctor or pharmacist. Some medications can affect balance, alertness, blood pressure, or reaction time, and a careful medication review may help reduce fall risk. The fifth habit is the one many people avoid, but it can change everything. Pay attention to the small signs before they become big problems. The body whispers before it shouts. Maybe you notice you are using furniture to steady yourself. Maybe you avoid stairs more than before. Maybe you shuffle when you are tired. Maybe you stop lifting your feet fully. Maybe one leg feels weaker, or your shoes wear down unevenly. Maybe you stop walking as far because your legs feel heavy, your knees ache, or your balance feels uncertain. Those are not things to ignore. They are clues. This is also the right moment to ask some simple questions. Did this change start after a new medicine or dose change? Am I sleeping poorly? Am I moving less because I am afraid? Are my shoes helping me or hurting me? Am I having more numbness in my feet? Am I eating regularly enough to keep my energy steady? Have I had my vision checked? These are not dramatic questions, but they are powerful. Better movement after 60 is often about noticing the missing support, not blaming age for everything. And let's talk about shoes for a moment, because this is one of the most practical changes you can make. Many falls and stumbles happen in footwear that feels cozy, but gives very little support. Loose slippers, worn-out soles, shoes that slide, or socks on smooth floors can make balance harder. A steady shoe that fits well, grips the floor, and does not flop around can make walking feel more secure right away. It is not glamorous advice, I know. But it is useful. And useful is what keeps people independent. There is another piece of this that deserves more attention. Sleep. Poor sleep can make movement worse in ways people do not expect. If you wake up tired, your reaction time is slower. Pain often feels stronger. Patience is lower. Balance can feel off. You may drag through the morning and move less, and once again that stiffness cycle begins. So a gentle evening routine is actually part of moving better the next day. Try keeping a regular bedtime. Keep the room quiet and dark if you can. Avoid large, heavy meals too close to bed. If naps are very long and late, nighttime sleep may suffer. And if you snore loudly, stop breathing during sleep, or wake up exhausted no matter how long you stay in bed, talk with a healthcare professional. Better sleep does not solve every movement problem, but it can make your body easier to live in. I also want to speak to the fear that many older adults carry silently. The fear of falling. The fear of becoming a burden. The fear that one bad day means life is about to shrink. Those fears are real, and I never want to dismiss them. But fear can become its own trap. Once people feel unsteady, they often stop doing the very things that would help them stay capable. They stop walking to the mailbox. They stop taking the stairs. They stop visiting friends. They stop trusting their body. That loss of confidence can be just as limiting as pain. So if fear has been holding you back, start with the safest, smallest version of movement you can do. Hold the counter. Walk with someone. Use the hallway. Practice getting up from a chair. Confidence does not usually come before action. Confidence often comes from repeated, safe action. Let me give you a simple picture of what this can look like. A woman wakes up stiff and slow. In the past, she would stand too fast, feel shaky, and spend the whole morning worried. Now she gives herself 1 minute in bed to wake up the joints. She sits before standing. She drinks some water with breakfast. She walks for 5 minutes after eating. Later, she practices standing from the chair 3 times with control. In the evening, she lays out steady shoes for the next day and goes to bed a little earlier. None of these habits are dramatic, but together they change her day. She feels less rushed, less frightened, and more capable. That is what gentle habits can do. They add up. And if you are a caregiver watching this for someone you love, please know that your role matters too. Sometimes the best support is not pushing harder. It is making healthy movement feel safe and normal. Clear the walkway. Encourage short walks, not long lectures. Notice if dizziness or confusion is new. Ask about shoes. Ask about sleep. Ask about medicine changes. Celebrate small wins. A person who feels respected is much more likely to keep trying. So let's bring this all together. If you want to move better after 60, start by waking the body gently before standing. Move in short pieces through the day instead of waiting for one perfect workout. Build leg strength and balance with simple, useful movements like chair stands and countertop exercises. Protect hydration and slow down when changing positions. And notice small warning signs early, including changes in balance, walking, sleep, shoes, and medications. These habits may sound modest, but they support the things that matter most: getting to the bathroom safely, carrying groceries, enjoying a walk, cooking your meals, visiting the people you love, and living with more confidence. You do not need to become a different person overnight. You do not need a miracle fix. You do not need to punish your body into behaving. What you need is a kinder plan you can actually keep. That is how many people begin to move better after 60. Not through force. Through consistency. Through awareness. Through small choices that quietly make life easier. So here is your next step. Tomorrow morning, before your feet touch the floor, Give your body one gentle minute. Then later that day, take one short walk, even if it is only around the room. That is enough to begin. And when you're ready, come back and tell me which of these 5 habits you want to try first. If this helped you, subscribe, share it with someone you love, and keep walking with me. I'm Dr. Amelia Watson, and I truly believe that with the right support, many people can feel steadier, safer, and more at home in their body again.